We're just waiting for the YouTube to make the Zoom link. It's a crazy amount of additional IT skill that I've somehow had to gain over this past 12 months.
Yeah.
We're hanging with it. I think we're going to be on YouTube, and those of you who are here with us in the Zoom webinar, fantastic. Thank you very much for being with us, you all. So tonight, these are very challenging times in Ballard and really all Seattle neighborhoods. Folks on the left are compassionate with the plight of the many who found themselves in desperate times and take great umbrage with those who have the audacity to argue in the media or otherwise that Seattle is dying from some of these urban symptoms. Meanwhile, other folks argue that our state, county, and especially city elected leaders don't care about all the people who live and work here and are not committed to prioritizing the problems of homelessness nor the issues that it creates all over the city and the county. All people who live in the area, though, regardless of political leanings, are saddened and frustrated by the lack of progress in addressing the complex impacts and visible agonies of homelessness, the lack of transparency in decision making. People want to know how these decisions are getting made and where the communities and the neighborhoods affected get to play a constructive and active voice in that. In the response to our announcement of this meeting, we've heard wide and strong opinions from people in Ballard, and we're hoping to at least get a better understanding of some of the real data on efforts at coordinated solutions and not just another recap of the issues, problems, and delays that we've already heard too often already. We hope for acknowledgement of some of the themes that have not received a spotlight from city, county, or state government to date. Whether or not Seattle is dying, people are dying from hypothermia, from drug overdoses, from violent crime. We also know that neighborhoods may not be dying, but they are living with the real and terrible impacts in the place that we live. Last month, we held a very positive district council meeting that introduced numerous agencies and folks right here in Ballard involved in trying to mediate and mitigate the challenges of homelessness for those who are suffering it. And there sure are numerous folks working very earnestly and constantly at a local level trying to help the local homeless population here. Tonight, we move to a discussion of how our government is trying to respond to these issues at multiple levels and in coordination with each other. So our meeting comes in three parts tonight. First, introductions from the three panelists and our local council members. So I'll mention them real quick in a sec. And then we're also, and then second, we're going to have a panel discussion that's just centered on the questions that we've prepared here at the BDC Executive Board. And then lastly, we'll welcome several of you attending for a community Q&A session on the meeting with us. It'll take me a minute probably to kind of promote you into the panel discussion, but we'll do that as best we can. And then we'll ask you to use the raise hand button, whether you're in the panel already or are in the community in the audience, to raise your hand if you want to ask a question. And it'll work just like kind of any other meeting where you raise your hand and we'll call on you. And if called upon, we request that you keep your question very concise and to the point. And further, we ask that, all people be treated with patience and all due respect, even if you get frustrated with the tenor of the conversation. I'll also say just right now that our meeting is not going to be long enough to address all the questions or come to a tidy conclusion on everything as much as we'd like to. But we aim to move forward the dialogue and contribute to more effective outcomes regardless. So out of respect for people participating and attending, we're going to try and finish up timely. We're getting started a few minutes late, but we'll try and still shut it down by about 8:35, 8:40 at the latest. So with that, I want to introduce our three panelists and an additional special guest member from City Council. All these folks have agreed to try and keep it real concise and quick here. We've actually asked the first of our panelists, Senator Reuven Carlyle, to spend a few minutes at the beginning of his time to talk more broadly about work that he's doing at the state, since we haven't had you at the council for a little while, Senator. The others of you we're hoping can just kind of focus on the agenda topic at hand. First is Reuven Carlyle in his 12th year representing us here in the 36th Legislative District. He's the chair of the Senate Environment, Energy, and Technology Committee and also serves on the Ways and Means Rules Committee. Then we'll hear from King County Councilmember Jeanne Kohl-Welles, who is the chair of the County Council's Budget Committee and also the vice chair of Community Health and Human Services Committee. And then Seattle City Councilmember Andrew Lewis joins us tonight. Very pleased to have him. He's the chair of the Select Committee on Homeless Strategies and Investments, representing District 7 in our City Council. And then we also have our own Councilmember Dan Strauss here tonight, who's also the chair of Land Use and Neighborhoods. So I've introduced all 4 of you. I'm just going to let it go 1, 2, 3, 4 like that, and ask you again to try and hit it quickly, and we'll move on to the conversation. Senator Carlyle.
Thank you so much, Brent. I really appreciate it. Can I confirm that you can hear me?
You bet.
All right. Thank you so much. And thanks everyone for your understanding and your grace. I'm on my phone tonight. We just finished up floor action down here in the legislature. I just really appreciate this opportunity, and I know how important these issues are to everybody, and I'm just incredibly grateful that everyone's able to get together. And just want to begin with a moment of personal grace and acknowledging the profound difficulty that we're all facing, the emotional toll. My wife is an anesthesiologist at Ballard Swedish and is just sort of as exhausted as the rest of the first responders in the healthcare community with COVID. And so I just sort of want to take a moment to acknowledge the magnitude of the weight on all of us. Today was an incredible day. We passed in the state Senate, it's going straight to the governor now, a $2.2 billion federal CARES Act package. The allocation of those dollars is incredibly important. The basic breakdown is we have about $1.7 billion in a combined small business tax relief, which is overwhelmingly driven by the unemployment insurance cost. I had a conference call last week with the brew pubs of Ballard, and some of them have unemployment insurance increases from $300 a year to $10,000 a year due to COVID, due to no fault of their own. So incredibly important to recognize the impact on small business, which is the heart and the soul of not only Ballard, but of course of our entire city. So very focused on using federal dollars for that. We have about $618 million in vaccine administrative support, contact tracing support, and additional testing. We're working very hard with all the healthcare entities to get a much more organized approach. As folks know, we have a vaccine deficit. We simply don't have enough vaccines. That is job number one, not only in COVID relief, but is just getting shots into arms. So a huge effort in partnership, not only with Swedish and Ballard, but of course, throughout the city and throughout the state. We have about $668 million in educational and school relief for in-person learning so that we can accelerate the return to in-person. That means helping our teachers and administrators get the support, the vaccinations that they need, and getting our kids back into school. We all know the profound, deep, emotional impact on kids and the impact on families. A lot of the money also is going toward childcare to support families as we try to get our schools reopened. There's $365 million in rental assistance for both tenants and landlords. I want to be really clear that one of my top priorities, and I know that that Councilmember Kohl-Welles and Councilmembers Strauss and Lewis and others support this, but it is imperative that we recognize how many small landlords are really struggling to make payments and on their mortgages. And so very focused on that. We made some strong improvements to the bill to make sure that the eligibility is accurate on that front. I would also say that we have $26 million in this package in food assistance, $50 million in additional childcare. So many other activities. My priority this year, in addition to job number one, which is COVID relief and getting our schools and our economy reopened, is climate change and action. I'm very proud to be a chair of the committee that is sponsoring the governor's package and all of the governor's legislation on this. So a ton of activities. I would just note, I'm working very closely with new Representative Liz Berry, as well as my good colleague, Representative Frame, on a comprehensive transportation package that includes some important investments as we integrate not just sound transit, but as we integrate the next generation of multimodal and the next generation of density and growing smarter. So a lot of activity. I don't mean to be rhetorical about it, but we're working on that transportation package. I'm trying very focused on Highway 99 and trying to get some improvements to that in Intrabay relative to some of the multimodal and investments of neighborhoods. So I know there's a lot to talk about, but I just wanted to give you, we're in full thrones of the legislative session. If you need anything, I'm asking you, I've worked so hard to help people who had troubles with unemployment insurance. Reach out to my office. Reuven.Carlyle@leg.wa.gov, doing everything we can to be a great constituent service provider. It means a great deal to me personally and professionally, and I really appreciate the opportunity to connect with you tonight. Thanks, Brent. Brent, we're not hearing you.
Brent, when you need to unmute.
It's sometimes the simplest things that still confound us in these meetings. That's the first time I've done it yet, I think, this year. But anyway, thank you so much for being here, I said, and also thank you for being so quick and concise. Councilmember Kohl-Welles, please feel free to speak for a minute.
Thank you for having me. And I'm on the Zoom meetings all the time with our council work, and it's without fail, people forget to unmute all the time.
Yeah.
Anyway, I'm Councilmember Kohl-Welles, representing the 4th Council District that does include Ballard. And we all know that homelessness and addiction and mental illness are at the top of mind for many of us in this region. They're intersecting, but they're not synonymous. But I would like to remind you that in the county, we have 39 cities, one of which is Seattle. And we as a county do not have jurisdiction over a lot of what's going on in Ballard. Also, very much we are restricted from not doing anything on zoning and permitting in individual cities, only in the unincorporated parts of the county. And the county acts in many ways as a convener on homelessness and affordable housing issues, bringing all of the players together to find regional solutions in this crisis. So basically, if we look at homelessness as a very poignant example, the county receives state and federal money that we in turn issue in RFPs to service providers and community-based organizations across the region with a very top priority for geographical equity, not solely in Seattle, and with our equity and social justice lens all the time. We had 8 budgets passed last year at the county in 8 months. So this was unheard of, and it was my first year as budget chair. We had our biennial budget, but we also had 5 COVID budgets. And as Reuven mentioned, this is a huge issue for all of our legislative bodies. We had received $232 million from the feds last year in CARES Act funding. All of our budgets passed unanimously. I worked constantly on budgets. But I bring this up because we got a lot of money out for very highly needed programs, and we helped develop the executive, Constantine's budgets that he transmitted to us by developing our priorities, sending a motion over to him and the executive department last May. And we just updated those priorities for 2021 yesterday. And I think it's important to know that our top priority is public health and all the response and recovery because of the pandemic, but also food security, housing security, including homelessness services, economic recovery. We added this year child care and employment services. We also, again, included behavioral health, mental health services, substance abuse services, and added in safety and security, and also added in childcare, as I mentioned, and access to justice, which is really important. Millions of dollars flow through the county's levy collections, and I can talk as we go on about our King County Regional Homelessness Authority, our Health Through Housing Initiative, mental illness, drug dependency, and what's happening with that program, which has really taken a hit because it's sales tax funded, and also a newer program with the Public Defenders Association that's called Just Care, and how I'm working to hopefully expand that to Ballard Commons area. So I'll stop there and get into a discussion on some of these issues later. Thank you.
Yeah, thank you, Jeanne. I know we're very much looking forward to hearing a little more about the Regional Homeless Authority and the work the county's doing to try and just coordinate some of these efforts that are happening. Um, Pleased to be joined for the first time, I think at Ballard District Council by Seattle City Councilmember Andrew Lewis. Mr. Lewis, thanks for being here.
Yeah, thank you for inviting me. While Ballard is not in my district, I grew up in Ballard, so I do have a special affinity for the neighborhood, and I'm very familiar, obviously, with Ballard, the people that live there, and my parents still live there too, so I feel like I'm accountable to at least two people out there. So anyway, I'll jump in to talk about these topics. Thank you for inviting me here today. There's a lot to go over, so I'll try to stick, at least for this opening part, squarely within the 4 bullet points I was given in advance to address in my opening remarks. But as was said in queuing me up here, my name's Andrew Lewis, and I am the chair of the Select Committee on Homelessness Strategies and Investments for the Seattle City Council. Was elected in 2019 to replace my predecessor, Sally Bagshaw, who declined to run for re-election. But prior to that, served for a number of years as an assistant city attorney in the Seattle City Attorney's Office, so well-versed in a lot of these issues from my pre-council background as well. So to start off, the first question was, what is the city responsible for in the overlapping issues we're talking about today of homelessness, addiction, and mental illness? So the city of Seattle's primary role historically in homelessness response is in outreach, housing, and when necessary, enforcement. So the city of Seattle controls the police department. We have a housing levy that provides a lot of subsidized and supportive housing, including permanent supportive housing. And we fund a number of outreach efforts, including the REACH program, Chief Seattle Club, Public Defender Association, and others. Historically, what the city does not explicitly do is provide services in addiction and mental illness. Those are competencies that typically are the responsibility of the county and the state. I should note, though, there's nothing that in our charter or the Constitution that says that we can't necessarily make that commitment if the county and the state are not in a position to provide it, but would note that mental health, public health, addiction tend to be extremely expensive, particularly for large populations of uninsured individuals, and are better done at a state and county level. So it would be good to work it out in that way. But it is not historically a competency that the city has been expected to address. The next question was how and how often do you work with other levels of government and nonprofit advocacy groups on these issues? In my position all the time. During COVID in particular, there has been a lot of triage and restructuring work because of the strain that has been put on an already tenuous system of care for people experiencing homelessness. The city had to de-intensify, and the county for that matter too, de-intensify a lot of the shelters that have been operated, resulting in a much higher proportion of people experiencing homelessness being unsheltered folks experiencing homelessness. From an enforcement standpoint, folks who are homeless and engaged in low-level criminal activity are no longer in a position where they can credibly be arrested and booked due to the county de-intensifying the King County Jail down to, I believe, about 1,200 spaces from a peak of about 1,800. So that has severely restricted the ability of the Seattle Police Department to do bookings for misdemeanor quality of life offenses. That conceded, we can't police our way out of the issue of homelessness, but that is something that has hit us and we've had to try to adapt to. Councilmember Kohl-Welles mentioned the Just Care initiative, which the county has funded, which has been one of those initiatives to try to adapt to the inability to do traditional adjudication through the criminal legal system during this time of COVID. And I can talk more about that later as well. I'm sure Councilmember Kohl-Welles can too, but we've learned a lot of really interesting things from that initiative. And that's something that I think we really need to build on. And I look forward to continuing to work with Councilmember Kohl-Welles on supporting, expanding, protecting the Just Care initiative. In moving on to, well, actually, before I move on from that, but I guess it's related to this next question about the silos. I serve on the board of the King County Regional Homelessness Authority, so I'm happy to speak to that as well as we go through the conversation tonight. That the work of that body has been greatly delayed due to the COVID situation, including a 6-month delay in appointing an executive director. We did finally choose a really outstanding, I believe CEO is actually the title we're using for that authority, Regina Cannon, who will be hopefully accepting the offer and taking that position starting in March. And that is really the essential piece to begin moving forward with a lot of the initiatives we're going to talk about later. Particularly, I notice by name list and some other practices are kind of on the agenda. And hopefully that's all going to be based through the countywide King County Regional Homelessness Authority. So I'm happy to talk about how that might come together. In terms of breaching the silos of responsibility, my office interacts on a regular basis, through the King County Regional Homelessness Authority or the Board of Health or Regional Policy Committee, Puget Sound Regional Council, with various levels of government. Councilmember Strauss and I are frequently consulting and talking to our legislative delegation on this issue and others. Because it is necessary, as we've discussed earlier, there are these tiered responsibilities that all impact this topic. And sometimes that's through some of the formal regional boards where there's multiple folks from different governments on it. Sometimes it's just from calling folks in other offices and working through a specific issue. Like Just Care is a good example of that. And then finally, there's a question we hear a lot from the community, but what do you identify as working and not working at the Ballard level? One really big thing that did not work, horribly did not work, was the sweep and removal conducted by the city in May of Ballard Commons Park. I go by Ballard Commons Park on a fairly regular basis. You wouldn't know that the city had ever done a removal there because there was no sustained strategy and plan to keep folks who had been offered services and offered help in a place where they could receive those services and help so that they wouldn't go back to the park later. I think it's a good contrast from the strategy that we've been using in Chinatown ID and Pioneer Square around Just Care. I support Councilmember Kohl-Welles' work in working with us to bring Just Care to Ballard because that has worked in clearing a lot of public spaces, providing people the care they need, and putting them on a path to success in a way that that sweep first and think about what we're going to do with folks later strategy did not work. And we're living with the consequence of that months later. So, I'm happy to talk and expand on a lot of those topics. I've come prepared with a considerable amount of information. I do this on a regular basis for other community councils around the city. So as we go through, happy to discourse more on this, and I'm glad to be here.
Yeah, thank you very much, Councilmember. We appreciate you being here. We're certainly going to get into some of the details of some of that policy and programming, I'm sure, in this conversation. I was actually struck a little bit in what you're saying just now about the similarities between some of the work you're talking about not working and some of the work I've done in ecosystem restoration, where it's really the stewardship that makes all the difference, whether you can kind of restore an ecosystem. It's surprisingly similar, but I won't dissert on ecosystem restoration. I'll pass the torch. I appreciate you also being here, Dan. We're featuring folks who are really working on these issues at multiple levels of government, but of course that also does include Dan Strauss, our own council member, and he's certainly most focused on applying his policy work to our district. So we are pleased to be joined by him as well. And we're mostly keeping on time. You guys are doing a great job keeping it concise. I'll ask you to sort of hit it and quit it quick too, Dan, and then we'll move into some Q&A.
Thank you, Brent, and thank you everyone for having me. I know I wasn't originally on the agenda because the Councilmember Kohl-Welles, Senator Carlyle, and Councilmember Lewis really are the featured guests tonight, so I'll be brief. Just to say that in the last budget cycle, I was successful at bringing dedicated resources to our district for both behavioral health and chemical dependency outreach workers and District 6 specific outreach workers. Again, those were budgeted items. I'm now following up to ensure that those contracts are signed and delivered so that we can have people working in our community. I was the first person to bring dedicated resources like this to our neighborhood. But again, you know, talking about the navigation team or the HOPE team that was started last October, so not soon after, so very quick succession there. Or any of the contracted outreach workers, whether it's the ones that the Ballard Alliance helps do cost sharing with, or any of the hundreds of outreach workers across our city, they are only going to be as successful as the resources that they have available to them. You know, we know that when people are stabilized and they're able to either be in a hotel motel or 4 walls and a door that they can lock so that they can be stabilized, we know that the most requested services at once folks are stabilized are medically assisted treatment and behavioral health care. And that's, if you don't believe me, you can read the October 12th, 2020 article from Cairo 7, which highlights the good work of some UW researchers who studied the changes that Councilmember Lewis started talking about, which was our move away from congregate shelter to de-intensified shelter and how that makes such a big difference. We know what the solutions are. We have effective programs running both in the city and county level. And now we need the solutions at the scale of the problem. Like Councilmember Lewis just said about the encampment removal that occurred last May in the Ballard Commons Park, you couldn't tell it today. I walked through the park just twice just this week. And something that strikes me as well is that in the first 8 weeks of being in office, those were the pandemic started in the 9th week. In the first 8 weeks of being in office, there were 7 encampment removals within a half mile of the Ballard Commons Park. And so that's why I really say we need to address this crisis at the, we need solutions at the scale of this crisis because we have effective programs. We just need them to be scaled up to address everyone that's living outside. And Brent, happy to join you again for another Ballard District Council meeting. I'll leave most of the questions to these experts. And as I said before we got started, next month I will be at the Green Lake Community Council meeting, and so maybe in April.
Yeah, we'll definitely have you back soon, Dan, and certainly don't want you to feel prohibited to weigh into this conversation tonight over the next hour either. You're every bit welcome here to join the conversation.
Thank you.
Which we're going to try and focus in a way in 2 halves now for those of you attending. The first half for about the next 25 or 30 minutes, we'll focus on a series of kind of groups of questions that we've prepared as the board to kind of promote a focused conversation, kind of hopefully around the themes that are in these questions. And then we'll move on, as I said in my introduction, to kind of a more broad-minded Q&A from community members who are attendees of the webinar now, and we'll promote you as you raise your hand later in that part in half an hour-ish. I'm going to try to invite.
Excuse me, Brent.
Yeah, go ahead.
Brent, I am so sorry. I'm on my phone here, and I'm just heading out to get home tonight. And I just wanted to make myself available and again reiterate that if folks are still having issues with unemployment insurance or any other state issues, please reach out to my office. And I just really wanted to thank you for the opportunity to be here tonight. And I'm sorry that I just I can't make the whole event. And I just wanted people to know that as the legislative session moves on into high gear, not only is this big package we talked about happening, but there's a lot of other things. So if you've got issues or concerns, please reach out. And I just wanted to thank you again.
Reuven, I really appreciate your making time to be here in the midst of what is a really super busy time. We realized that it would be tough to even find you available to join us sort of this month of the session happening down there. And so appreciate that you can't stay, but know that we'll have you back. And I know I speak for myself and numerous others watching when I say that we're really pleased to hear about some of the progress you've made and bringing funding to some of those topics that you mentioned at the outset.
Thank you. And I just want to really thank my local government officials for their passion around really trying to tackle this issue of homelessness. I think we're all feeling it on every level, and the Ballard comments particularly, but we're just at a tipping point as a community. So I really appreciate it. And I hope the state's role in drug treatment and in behavioral health can kick it in high gear, because that's one of the critical missing links.
Well, we'll be counting on you to do all you can to help it happen.
Thank you. Thanks again.
Thank you.
Bye-bye.
So, Angie, I'm going to let you, Angie Gerald, the Vice President of Ballard District Council, I'm going to let Angie essentially moderate the effort to sort of work through these 3 different panels of questions.
All right. I think I am unmuted, and I was trying to share screen. Is that visible?
I'm seeing, yes, we're all seeing, it looks like we're seeing me talking. So if I mute myself, we won't see me.
Okay.
And we'll see.
All right. So let's see. Brent, I lost the final words that you said there, but I can give me a thumbs up if you can hear me now.
Yeah, we're
Okay.
hearing you just fine. And
Great.
I think the viewers are seeing the speaker view as well as this PDF with questions on it.
Perfect. Okay. Well, we're getting a little bit behind time-wise, and I'm very sorry that Senator Carlisle can't join us for this portion. But essentially, we have 3 different themed questions that we wanted to try and have a chance to talk with multiple levels of government about these. And we get so much feedback at the district council, and I'm sure it's nothing compared to the volume that all the legislators receive, but we tried to orient those around some themes that we feel like haven't typically been spotlighted, really coming from the neighborhood level up. And one of those is just, how can we reconnect with unhoused people who are lost in plain sight? I think we all have so many experiences every day with people who are suffering, people who are causing harm, so many interactions. And other than calling 911, or some of us might know certain agencies or caseworkers, but for the general neighborhood at large, we really don't know, how do you pass along information over time? How do we all work together other than just yammering away on social media or having little conversations as we go about the neighborhood? How do we come together as a neighborhood? So the questions are, other than 911, how can we communicate back and forth between people in the neighborhood and the social service network and criminal justice diversion? And also to ask, when will neighborhoods have coordinators who are known and accessible to the community at large? Right now, we really don't know who are the caseworkers, who are the different agencies that are active. So we're hoping that you can speak to that. I think we're at about 7:36, so we might zoom through this and just spend 4 or 5 minutes. And can we start with Councilmember Lewis?
Yeah, I can cover a couple things on this topic. I think it's pretty prescient because to your point about, when will we know, who the outreach workers are, how we can get in contact with them. That is the focal point of the Human Services Department, the council and the mayor's new vision on homelessness outreach that will emphasize, and Councilmember Strauss touched on this a little bit because he was a big champion in the budget process to get this resource for Ballard that'll get stood up, is to have region-based outreach workers that are going to be known and be a resource. I don't know if Mike Stewart is on the town hall from the Ballard BIA, but
he'll be joined in during the community question and answer part, so that's perfect. Yeah.
Great. If I'm not mistaken, though, I and maybe he can clarify because I'm not actually sure because I'm more familiar with the BIAs in my district, but Downtown Seattle Association, for example, does have a contract through the Metropolitan Improvement District with REACH, for example, and they have outreach workers that are well known to the ratepayers and the business owners. And it looks like Mike's coming in now. I don't know if that.
And part of the issue with that is that Ballard Alliance is fantastic, but really just has a very small footprint in our downtown neighborhood, whereas the greater Ballard area,
sure,
a lot of other areas. And so for us to communicate as a true community needs a broader accessible network for the neighborhood.
Right. So I guess what I was going to flag, and Mike can answer whether or not he has access to some reach workers, but I would say that the goal is to kind of extend that model downtown is enjoyed to other neighborhoods where there will be a resource like that that's directly, working with stakeholders like the BIA or community councils or whatever else. And Mike, I don't know if you want to just jump in and address that, since I kind of called you out a little bit there.
Yeah, you bet. No, thanks, Councilmember. I appreciate the thought there. Sure. So we actually were one of the first, outside of DSA, we were the first BIA, neighborhood district BIA, that employed an outreach worker. And we started that program about 3 years ago, maybe just a little bit longer than that. With the thought and premise that it is, as we saw the navigation team working around the city, they could be in Rainier Beach one day and Northeast Seattle and next to West Seattle, and there just really wasn't that opportunity for continuity. So for us to be able to have a dedicated worker really working in Ballard to sort of get to know those individuals seemed like a real benefit. And I think that bears that out. There's lots of other issues related to the whole process, but that we don't need to talk about. But one last thing I will say is that we as BIA directors who fund REACH programs and in part through the city, sometimes yes, sometimes no, we've been grouping together, and our hope and intent is to be able to really sort of connect the dots between those REACH workers that are funded through our organizations, as well as the additional workers that are coming online, as Councilmember Strauss mentioned earlier, because we think that there's certainly a need for continuity. And the other thing that's just very basic, but our REACH worker is a Monday through Friday position, right? And we know that there are people in need on Saturdays and Sunday as well. So our hope is to push that and kind of drive that conversation and be able to leverage these additional resources coming online so that we can truly have probably not 24/7, but 7 day a week availability and access to these folks.
Yeah, and just to round it out, I did meet earlier today with the Human Services Department to check in on the status of, because it's, we fund things in November. That doesn't necessarily mean they're, on the ground the second we get to January 1st, right? And they said that they have a request for proposals out right now to fill the regional contracts to get those workers on the ground. And I know Councilmember Strauss is going to be in touch with you about that as it's coming down. So that's the first part. The second part is the HOPE team is again aggregating, flags for some kind of outreach through the Find It, Fix It app. So that is still the primary platform that the HOPE team is going to be using in order to receive, to sort, to aggregate these kinds of signals for assistance. So that's another point, and that was definitely something where there was a little bit of discussion about whether that would still be the case in the transition from NAV team to HOPE team.
So, Councilmember, are you saying then that our primary avenue as just downtown citizens, community members in Ballard, if we see something that sort of needs attention, we're supposed to just pop it on to Find It, Fix It? That's going to be the main communication.
Yeah, but I want to be clear. I mean, if you see concerning criminal activity, you should call 911.
Yeah, I certainly understand that. But if you see someone who's just off their meds and is maybe, kind of a little bit crazed that day, you don't necessarily, this is what we're trying to do. We're trying to support the city and not having police response be the primary endeavor for any and everything, right? So the question is then, well, how do we interface to kind of help the community take care of itself, I guess, in the face of somebody who may be having a behavioral challenge?
I think one thing I could maybe clarify is that at the neighborhood level, like we used to have a community police team officer who, if there was, follow up on issues, he was someone that was, known in the neighborhood, and there's an email and phone number published. And whether someone needs help at the county or city level or this agency or that agency, we're kind of lacking that team went away with, the different funding and budget changes that were made. And it's kind of unclear right now with new things rolling out with the city, and especially with some of the different hotlines, like the crisis hotline, I think goes through more at the county level. There's so much community information about all the different people that, live with us in our neighborhood, and whether it's, starts out as a criminal call, but then later in the week, it's more just, oh, I'm worried. I noticed they're really, acting out of sorts today. How do we have those relationships, or how can there be conduits to just keep following up over time so that people are known carefully, privately within a system, but in a way that neighborhoods can really connect together to provide help?
I would say if there's if there's a chronic issue like an encampment that is maybe obstructing a right of way or something, and you want some outreach to go out there and make contact, through the Hope team and through, out through reach or whatever, find it, fix it is the thing you should do. But if you think that somebody is, is a potential threat to themselves or others, you should still call 911. I would add that the council did triple the size of Health One in the last budget, and Health One responds to calls like that. That almost certainly Health One is not going to be scaled and operational yet to get to Ballard, right now. But that is something that's in the cards for.
So currently Health One and also the Hope team are not currently active in Ballard?
They're neither. Well, no, the Hope team is active in the whole city, but it's going to get more effective when HSD puts out the contracts for the additional workers that are going to be geographically based, but they haven't been hired yet.
Okay.
Do you have any sense of timing? I mean, I can already hear the snarky comments about why it's called the Hope team, because you hope they'll do something. I'm just wondering how long it's going to be until we sort of see that staffed up a little bit, especially knowing, as I do personally, kind of how hiring and HR goes at the city.
Now, those are questions for the mayor's office. Now, once we've done something, it's out of our hands. Yeah. So. Could
I add something here too? I think this is an excellent discussion. I've got one of my staff listening in, and I'm going to work with him. We'll talk tomorrow about this, but that coordination link is so incredibly important. Now, as Mike know, the county did provide some fundings through our Federal CARES Act for small chambers and for businesses, and we're updating that, as I mentioned in our priorities motion yesterday. So our chambers can expect more money. Our businesses are going to be helped more through federal funds that come in. But we need that coordination link. And I'm going to work on that as much as we can do that at the county level.
Thank you.
Awesome.
Question on that. Isn't the neighborhood service center still existing and providing? I mean, because that's what used to be done.
I think a lot more could happen through there. It's fairly limited, the range of services. And obviously with COVID, it's not a walk-in center right now, but even not in the pandemic, it's fairly limited.
I know one of the former mayor had pulled back a lot on those neighborhoods.
Yeah, but I think there's great opportunity to use places like that more. So I think we should. It's hard to.
May I just jump in real brief? I'll keep it super brief.
No, absolutely, yeah.
Just to kind of piggyback on what Councilmember Lewis was saying, both about once we fund a position, we then have to follow up doggedly to ensure that the contracts are signed and delivered. And so that's also something that I'm doing this month. And then wanted to talk about Health One a little bit more, because we do have the funding budgeted for Health 2 and Health 3. I went on my ride along with Health One just last week, and one of the things that really struck me is talking about exactly what you had just brought up, which is once they go to a call, that's not their last interaction. Mm-hmm. So often they are following up with the people that they interact with a week later or more to ensure that the reason that they were called there is now resolved. And so, having that type of follow-up is really important. Another one of the reasons why I wanted to have District 6 specific outreach workers is to also be a consistent contact within the district, because the Hope team is going to be relying on so many different outreach workers. That's one of the benefits of this model, is that we can rely on outreach workers across the city. And again, that's why I wanted to have some District 6 specific ones. All of that to say, we need, I guess also as far as who to call, I think it's important that when people are calling 911 to be very clear with what they are experiencing. If they have imminent threat to life or bodily harm, to make that known. If they're calling about a behavioral health issue or a medical issue, just to be very clear with that, because that will assist the 911 operators in directing the correct first responder to the call.
Thank you. So I'm going to zoom forward to our next question. We're not going to be able to dive as deep into each of these. We're really determined to make sure we let community questions also come up as we get closer to 8 o'clock here. Is my screen successfully being shared?
It is.
It is, great. Okay, so how can community feedback and lessons learned in Ballard contribute to improved evidence-based strategies? For about a decade, we've heard phrases like housing first, evidence-based, and harm reduction, and we've had many programs added to our neighborhood. Yet public suffering and harm seems to only increase, polarizing political discussions. How can Ballard cultivate measurable evidence of successes that are readily felt and seen by our entire local community? How can Seattle neighborhoods' lessons learned be incorporated into regional and statewide efforts? And Councilmember Kohl-Welles, I don't know if you'd like to start on this one. I had hoped to bring Senator Carlyle into the conversation also, but.
I don't know that this is as relevant for the county, but I think maybe when we get to your next batch of questions, it would be more relevant for me to bring.
Well, I'll push back on that a little bit because I feel like we're told about, programs like LEAD. We obviously, everyone knows housing first is best practice. We hear all of these phrases a lot, and a lot of this has happened in Ballard over the last 10 years. But the opportunities for the community to come together and provide feedback, simple things like accountability for good neighbor agreements 3, 5, 8 years later, who really looks after that? How do we evolve, and how can Ballard contribute to the evidence of these, things that have been really well researched, maybe in other areas, maybe in ours, but the neighborhood isn't really at the table in in contributing to how things evolve over time. So it's something that we just get asked a lot, and it comes up in conversations a lot. How do we participate in as things evolve over time?
I don't think the county is the relevant player here as much. Housing First and all of these ones have certainly been part of county funded programs, but we're funneling those mainly to the city or to the nonprofits and so forth. But when we really get into the discussion on the Regional Homelessness Authority and what we're trying to do with Just Cares and a very exciting program, Health Through Housing, which we passed last summer, I believe, at the County Council manically for a 0.1% sales tax increase, which I agree is not good to do, but we had no choice. And we were given that authority by the state legislature. And I think it shows a lot of promise. And so that's why I'm saying I'm not the best one to discuss this question.
Councilmember Lewis, do you want to jump in?
Or could I give you just a second and then I'll pass
Absolutely.
it off to Councilmember Lewis? Just to say that, one of the reasons why I continue to say that we have to provide solutions at the scale of this crisis is because we have had these evidence-based effective programs put in place in our district, and we haven't put them at the scale that we need them at. And so when we continue to nip around the edges of people suffering on the streets, then we're not able to solve for the whole issue. And so that's one of the important roles that the Regional Authority on Homelessness is providing, is also because Seattle has borne the burden of a regional crisis for far too long. And so ensuring that everyone's engaged in these solutions. So I do think that the programs that we see in Ballard and elsewhere are good, effective programs. I think for me, the lesson learned is that we have to do it at the scale, at scale. Otherwise, we're not going to have a felt difference.
Well, I guess what we're trying to ask in this question also, though, is not just how do we scale these things up, but also how can Ballard contribute to how things are scaled up? How can we've learned lessons, and how do people channel that feedback in, or how do we have community discussions about how well things are working or not with a lot of the different programs and policies?
I'll say something on that. And of course, Councilmember Lewis is a member of the Regional Homelessness Authority Governing Board, I believe. But the way it was set up is that there would be opportunities for participation. And there are individuals on the governing board, as well as the other, what is it called? It's been a while since I worked on this, the other committee, the implementation board or committee, who have experienced homelessness themselves, and that was a very deliberate aspect of what we included in the legislation. But you can attend the meetings. You can provide public testimony. You can talk about what Ballard has been doing, what it's been through, what's on the horizon. That's a really critical part. You can come to county council meetings, to our community health, housing, human services committee, or a committee of the whole. I mean, watch the agenda, subscribe to my e-news, because I bring out these meetings. And
So communities need to be proactive, though.
They have to be proactive. I mean, we're spread pretty thin, and we're all working very hard full time, and we want to be responsive. So I'm saying, yes, be proactive. And now that it's on Zoom, it's in a way a lot easier to do that.
Mm-hmm. Councilmember Lewis, will you be really sad if we start to ease toward the next question, or do you want to get a few points in?
Yeah, I could jump in on this one really quickly. I mean, I think that part of it is going to be, as we go through this regional strategy, every neighborhood, every city in this county is going to have to take on part of what we know the solution is going to be, and that's going to be permanent supportive housing. In the short term, that's going to be additive shelter. And I think part of it is approaching it with a yes in my backyard kind of attitude that is proactive, but that works through potential challenges. But that is committed to finding a way to get to yes on hosting some of these buildings. I mean, I live in the Uptown neighborhood. I live directly across the street from a Seattle Housing Authority building that has a lot of supportive housing, and they're great neighbors. I live right down the street from over 100 units of Plymouth housing that's going in. My only regret is it's not 200 units. They're great neighbors. You know, I would rather live next to 100 folks in permanent supportive housing than 8 tents. And I think that that's the attitude that all of us need to adopt and go forward with, because that's going to be our, the way that we get rid of the tent is by scaling up permanent supportive housing. And I can talk more about that later. But I think that part of it is going to be, Ballard's an urban village. Some of that permanent supportive housing is going there, and let's have a conversation about how we can make that an integral part of the community, because right here in the heart of our arts district in Uptown, we're putting in a big building, and every community should be petitioning to do the same thing.
Yeah, and I guess the point, we've been doing these things, and we have lessons learned. So I guess we're just trying to also encourage that kind of dialogue. It's not like none of this has happened in Ballard and we need to say yes. It's been happening, and I just want to really encourage more localized dialogue where the lessons learned can really bubble up from the community level up, because I'm sure other neighborhoods also have a lot of feedback they'd like to participate in. I am going to
share those concerns with your district council member.
Believe me, I know his volume of phone calls and emails is well, let's see.
For sure, prodigious.
I'm going to go ahead and try and share my screen one last time here. And we're going to zip through this one quickly because we really do want to get to the community questions and answers. But this is where we had hoped to talk about some of the higher levels of government, regional, state, and federal leadership. Was hoping Senator Carlyle, maybe he can provide us an update at a later point, but we're wondering what new developments from the federal government offer a possible tipping point to decrease unsheltered homelessness. I'm assuming that would pipe down through the state, but maybe some of you can speak to that. What are the next steps for the Regional Homelessness Authority and the new CEO? We touched on that a little bit already. What bills or other legislative actions should the Ballard community be aware of and provide constructive feedback and support? And probably most importantly, what is the status of behavioral health at the state level, including at Western State Hospital, the new UW inpatient teaching hospital, and other programs that are coming online? So this is far too much to cover in 2 minutes here, but we do want to get onto the community question and answer session. So maybe we can try and just touch briefly on a few of these things, and just to say that these are definitely all areas that we're kind of all waiting with bated breath to hear. Is the cavalry coming in? Is more help coming?
Well, and probably a center focus of that, Angie, for this sort of brief discussion for just 3 or 5 minutes, it should probably be focused more on this question of the Regional Homeless Authority, what it does, what it's going to do, how it works, how it's going to help us. We aren't really hearing that much about it. And we're certainly not seeing results, I don't think many of us in our neighborhood, that we would attribute to it.
Yeah, so I'm happy to run down all these real quick because I'm just bursting at the seams here to talk about some of these because there is some good. Can we go back to the list though, Angie? Sorry, it just
Yeah,
No
yeah,
problem.
yep,
if you can load it up there.
yep, no problem. Yeah,
I mean, the talking about the federal government thing, and this is something Councilmember Kohl-Welles could probably jump in on too. The Biden administration coming in offers a really big seismic shift in the resources that could be available to us, particularly in FEMA reimbursement. And this touches a lot on Just Care. And I do just want to share a little bit of information about Just Care, because I know we've been talking about it a bit around the edges, but they contacted, for the data that we have available from January 7th, 2021, which is the most recent data that has been provided. They have made contact with 193 individuals through Just Care in the Chinatown ID Pioneer Square courthouse area. Out of those 193 folks, only 4 of those folks refused an offer of housing. And it's an important thing to remember because there is there's a presumption out there that there's sort of unlimited housing, that people are choosing to be homeless, that they're choosing to stay in a state of, sort of squalor and addiction. We just have not found that to be the case. And as we can scale and develop these programs, it's the best tool that we have to remove tent encampments and to remove a lot of the related chronic issues that come with them. So, the Just Care program was a little on the ropes due to funding, due to the expiration of a lot of limited federal money that we had received. And when I say we, I mostly mean the county, which has been paying for it. Since FEMA reimbursement can now go to 100% and can pay for hotel rooms, that offers some possible levers where the city could maybe get involved in initiatives like that. And that's something I'm continuing to work on because the part of the challenge is we could end up getting to a cliff here where a lot of those people that are in these Just Care hotels will just be shoved right back out on the street. And that's the last thing that we need right now, given the situation for them, for the community, for everybody. So that's going to be a big thing that having the federal government, the shift in federal leadership is going to have a big impact in terms of that FEMA resource and the ability to possibly unlock it, as well as aid for state and federal governments that's in the most recent package before Congress that hopefully will get passed. In pivoting to the regional.
Andy, could I just comment since you're on Just Care, just a little bit of an update.
Please.
The county provided about $4 million for Just Care, and I think our 4th COVID budget, somewhere like that, we did 5 last year. And at that time, the federal restrictions were that all money had to be expended by December 30th, any CARES Act funding. So we provided an additional month for January for it to continue. And that was pretty costly to do that. And now we have put in some more money so they can continue through the end of March. We do have, as I said, our COVID-6 budget coming up, but there's some issue. Not all council members are on board with Just Care at this point. It's very expensive. And it was figured it would be about $1 million per year per participant. And yet we know it, I believe it does a good job, but there's been no conclusive evaluation done because everything has been done so fast. I did get $200,000 in our budget last year to look at extending this to Ballard Commons, to Lake City, to West Seattle Junction, but we'll have to see how that goes. I think it's in a precarious position. And so any community support would be very helpful. We did get a clarification that in our health through housing 0.1% sales tax, where we're able to purchase hotels, old nursing home facilities or whatever, the county would be, that we could include Just Care work in that. But we're waiting for some clarification from the legislature on that. So that's all.
Yeah, I appreciate that additional context.
So I'm just going to jump in and say, if you want to say something about the regional authority, I don't want to
Yeah.
cut you off from doing so, Andrew, but I also want to make sure we try and jump in the next minute or so over to welcoming in some community questions, since we did promise.
Yeah, I'm happy to do that real briefly. And you know, Brent, to your comment earlier about how it doesn't really seem like the regional authority has done anything, or there hasn't been an impact felt in the community. That is an absolutely correct observation, because the authority has not had a executive director yet, and that's been what we've been dedicating all our work to securing. We conducted a national search for the executive director due to COVID. That took a very long time and was 6 months behind schedule. But we did find a candidate in Regina Cannon, who has extensive history working in the areas of housing, homelessness, and public health, mostly in the Atlanta, Georgia area. And she will be, she really is going to be a great pick to stitch together all the disparate interests from around the county. That was really critical, since she is going to be charged with marshaling all the resources of the county and the various governments to meet this crisis. And really, the executive director had to be in place first before there could be any strategic planning, since the way the interlocutory agreement is, or the intergovernment agreement is structured, gives the CEO a considerable amount of power over how to implement and arrange the resources. I certainly, as a board member, have a lot of ideas of what I would like to see that form part of that regional strategy as we go forward, including, I mean, what was alluded to earlier. You know, I think by name list is a great practice that we should be adapting. I think we also need to make sure that there's a strong team that's centralized with CEO Cannon to make sure that policy can, accountability and policy can be more centralized and less disparate when we talk about this issue. And, you know, that's the update as it stands now. If she accepts the offer, she will start on March 1st, and then we'll have more information going forward, and there will be more decisions made about what will and won't be transferred to the regional authority. But, you know, the hope is that that is going to solve a lot of the issues that we've been seeing historically in terms of what is whose responsibility, you know, where does the responsibility lie for, you know, for certain actions to be taken or not taken. And this will have hopefully that centralizing effect to make sure that accountability, resource, and result is centralized in one place. So that's the goal.
Sounds good. Sounds
Could I-
good. You can't, go ahead.
I'd like to add a little bit in here. This proposal was passed a year ago, November, early December rather, and I was the lead on the county. We had to get it through the Regional Policy Council, which was very critical, and the Seattle City Council. It was almost unheard of to do that. But the suburban cities fought this, and we did not have unanimity, and we had to really compromise a great deal. And as a result, things didn't start off as smoothly, and apparently some of the the suburban cities are still having some different perspectives than what Seattle and perhaps King County does. But what it does, and this is important to know, it'll take on the role, or it is taking on the role of coordinating funding, contracting, service delivery, and performance measurement for this for a truly regional response. The county in our biennial budget passed last December reflects the transfer of $126 million into the Regional Homeless Authority, and I think the city's contribution is even more. And so that it's going to be hopefully it's going to be very cost effective and be able to streamline and avoid redundancy that had been happening so much. So it's a good thing, and it's just unfortunate it's taken so long to get off the ground, but there have been real reasons such as COVID response too.
And getting to work with you, Councilmember Kohl-Welles, last November and December to get it, you know, through all of those internal politics
Yeah.
at the county level and then through the city council. It was a pleasure to get to work with you there. get this thing off the
It
ground.
was amazing.
Thank you.
And Sally Bagshaw was instrumental.
We really should move on to the community questions now. And one of the reasons we really want to hear from community is with the regional authority rolling out and with a lot of the pushback that has been happening, you know, in Renton and Bellevue and SeaTac and different areas. We want to make sure that, you know, lessons learned and things that we, you know, have been implemented in Seattle, that other communities do want to invite these into their neighborhood and that there is less pushback. And we can say, well, these were issues that were had. Here's how we worked through it. Come on, let's do this together. So with that, let's move on to some of the community voices and questions here in that spirit.
So I'm going to just ask for process basis that anyone in the attendee group wants to ask a question and join the discussion, just hit your raised hand button. The first person I noted who'd done that this evening was Jeanne Darcy, who's a board member on the Ballard Community Task Force on Homelessness and Hunger. So I just promoted her. I see some other hands popping up who I'll pick here in just a sec. But Jeanne, if you want to go ahead, I don't know if you have a camera that you can turn on. I'm asking you to make it turn on there.
Let me see if I can do that. Start your
We
video.
have a little
Yes,
button
I
down
can.
the bottom of the
Yay.
left
There we
there.
go.
There you
Aha.
go.
Excellent. Thank you. Yeah. I'm a member of the Ballard Community Task Force on Homelessness and Hunger, and they've asked me to ask a question on their behalf. We've been around for a long time in various incarnations. We're still a volunteer organization consisting of community members. The panel here has an awesome responsibility to represent their constituents, both housed and unhoused, in this time of pandemic and looming economic depression, followed closely on by the climate crisis. You know, and we know that the amount of funding required to meet the massive housing and services needs of our homeless neighbors must and should come from the federal government. The amount that's coming is good, but it's not enough. You know, and we know that our state and local taxes can't possibly cover all the emergencies and essentials we're handling in these times. Our questions for you are, how can we help you get the money needed from the federal government? And do you have a plan for doing this? And what is your plan? How can we be involved? And I'm sorry, Senator Carlyle is not here because he's.
I would be glad to start off. And Jeanne, I can't answer all those questions, and we don't, you know, with the limited time. And
It's a big one, I know.
it is, there's a lot there. I'm very encouraged, again, as was already said about the Biden administration. We received $45 million into our account directly from the US Treasury about a month ago. And that is for rental tenant assistance. Now, this is critical because we need to stop people from having to become homeless. And we know that income inequality is growing dramatically, and resources in the city of Seattle and beyond are diminishing for people to be able to even afford to live here anymore. And I saw recently, maybe yesterday, that Seattle is, I believe, the second, or King County is the second county now in the country for people leaving the area. And I believe the same is the case for the city of Seattle because they can't afford it anymore. So the Treasury, the Federal Reserve had results from a poll in 2016, way before the pandemic, that indicated that 46% of the US population is unable to come up with $400 for an emergency situation without having to sell something or borrow money. It's much worse now. So that's not an answer to your question, but stay tuned. We are really going to be strong in the county for being able to use effectively the federal funds we're going to get. But our federal lobbyists work very hard, and we happen to have a great delegation overall of our 2 US senators and our members of Congress. Certainly Pramila Jayapal is our US representative. They know, but it doesn't hurt to reinforce. They know, and we tell them all the time too.
So that
Thank
you want us to tell them.
Well, it's probably, they know and their values are there. I don't think we need to tell them. They're working hard. And fortunately, there's a Democratic majority in effect, basically, in the Senate now. But it doesn't hurt to reinforce that.
Can
But
I ask you,
we're on a good
do you
path.
think our senators, our US senators really do understand that that the federal government can do this?
Oh, I think Maria Cantwell and Patty Murray definitely do.
Okay.
So that's the point. We have a very good, strong delegation.
I would love them to speak out about this.
Yeah.
Be in touch, Jeanne,
Can
is
do more.
the advice, contact their office, I think.
Yeah.
Move on in questions and invite a longtime community volunteer and community advocate, Rudy Pantoya, to join us and ask a question.
Hi, thank you thanks for letting me be here.
Rudy, you're not driving right now, are you?
No, I'm over here on Aurora watching a little bit of trafficking and other activities that most people don't see other than on TV news or on a TV show. I see it, smell it, and touch it and clean it up every day. But I'm safe because I'm safe. Okay, I'm in a safe spot. I'm in my office. I'm in the car. I'm on the streets. Anyway, my question is I'm hearing from Housing First, we leave it to their own devices, and when they're ready, we can link them to services. And when I hear the word stabilization, once they've got stability, we can link them to services and get them on a path that they need to go. Now, harm reduction versus I hear harm reduction and hear
Rudy,
other.
we're short on time. Are you going to ask a question?
So that's my question is when is it that how do you define stability, whether you're in a tent or a home where somebody is in need of services? And those services are open right now in person. The people are saying, well, we've got the pandemic and there's no in person. Well, that's bunk. And you know where the Patricia Steele building over there on 4th and Jefferson is, county funded, and the services are open for all communities. They're there for mental health, addiction, and medical issues. And we see these girls walking up and down the street, nobody reaching out. I don't see the social workers like I'm hearing from Andrew Lewis.
All right, let's give him a chance to respond.
Did you want me to jump in there, Brent, or did you want?
As you like, Dan. You and Councilmember
Dan,
Lewis
if you wanna
both
go
have
first,
something to
go
say real
ahead.
quick.
Sure. And Rudy, you signed up for district office hours a couple weeks ago. It was nice to chat with you. I hope that Lena in my office followed up with those numbers to call if you're seeing trafficking. When we talk about stabilization to me means being in a safe, warm, dry place that you can close the door to the outside world. So that does not mean a tent. That does not mean continuing to live outside. It's not necessarily a tiny home village. It's not necessarily a hotel room. It could also be permanent supportive housing or transitional housing. But what is very clear to me is that we need a safe, warm, dry place that somebody can go with their pets, possessions, or partners. And that's, for me, what baseline stabilization means.
It's frustrating to me to be on the streets and not being able to have the infrastructure here in North Seattle to be able to address this cold chill we're going to be having, where we find somebody on the sidewalk. Who do we call? We got to call 911 and do a welfare check. They do the welfare check, and then or they're ending up at the hospital where there's triage. That's the only place we have to send some of these people that are on the streets, that are hungry, angry, lonely, tired. When that's supposed to be for other services, we're going to overwhelm these hospitals unless we make a change, like quick.
That's exactly right. We have roughly 2,500 shelter beds available to the city of Seattle. Councilmember Lewis, correct me if I'm wrong on that number. And then we've got an additional 3,741-ish people living outside. And, when I've got this real-time tracker on how many shelter beds are open any given night. And, we've got 24 shelters on this list, and at best any night there's 4 beds open. And so
How many in North Seattle?
Let me follow up with you offline because I know that Brent has given me the eye of we need to keep
I
moving.
am
on.
hoping to keep going around, and I didn't want to prohibit Mr. Lewis from making a quick comment if he had one.
I mean, I think to get to more questions, I'll just, I agree with Councilmember Strauss's answers, and his numbers were correct. I can verify that.
Awesome. I appreciate that. Yeah. Before I give you the mic, council member, I'm just going to say that it's about 8:19, 8:20 right now. I promised folks we were going to try and finish by 8:35. But if I see nodding from all the invited panelists right now, maybe we'll just let this roll about an extra 15 minutes and agree to an 8:45 closeout time since we got started a little late.
So quickly,
I don't see one refusing. You go ahead, Jeanne.
thank you. The city and county opened as of, I think, yesterday or the night before at the Seattle Center, I think at the Fisher Pavilion, a joint cold weather shelter. Also, and that's run by the Salvation Army, operated also on 6th Avenue down in the Soho area. And I'm sorry, I don't know the cross street. The Salvation Army has been running a large congregate shelter with adequate or appropriate social distancing, et cetera, holding a couple of hundred people or more. And they also have opened up for emergency winter shelter. There's not enough and the demand's growing. It's a huge issue. And we're trying to get funding and be able to do more. It's the reality.
That's certainly what we need. Laura Zahava is with us. She is a co-owner of Stoop Brewing, and Stoop Brewing is, of course, a partner in the Ballard Brewed Coalition. For a lot of us, home-produced Ballard brews have been essential services for this COVID period. Thanks for being here, Laura.
Well, thank you. I really appreciate the invitation. This is a lot of really fascinating information. So I just wanted to say, I hope it's not redundant for me to ask for some clarification in the scope or the type of organizations that Reach versus Just Care versus the Hope Team are and what they are actually doing out in the community, because I'm not personally so clear on that.
Yeah, I can jump in real quick on that because that is a good question. And, you know, I mean, the three of us kind of talk about these things every day and sometimes forget that that's not immediately clear when we are talking in a forum like this. So it's a great question. So Reach is an outreach provider. So they're a provider agency that's contracted with. They hire outreach workers that do direct outreach to folks experiencing homelessness and then do service navigation and support work. They're under the umbrella at the city of the Hope Team, which is the replacement of the former navigation team. The Hope Team, which stands for homelessness outreach provider ecosystem, is basically it's the city team that is the hub that oversees the providers, makes sure that the providers have the resources they need from city departments, and coordinates with the providers in terms of where we need folks to go, in terms of going through the Find It, Fix It app locations that are being flagged. But the actual outreach is provided by the providers, like Reach. Chief Seattle Club would be another example of an organization that we contract with, and the Public Defender Association, which runs the LEAD program, is another outreach organization that goes under that umbrella. So the Hope Team is like the city coordinating hub. They're employees of the city in the Human Services Department. Just Care is a unique consortium of providers that formed, as Councilmember Kohl-Welles was describing, through county one-time federal money during COVID. Particularly around county properties in the Chinatown ID and Pioneer Square. And that consortium is mostly organized around the Public Defender Association, which operates the LEAD program, Law Enforcement Assisted Diversion, but it included Asian Counseling Referral Services, which is a health provider, Chief Seattle Club, and a number of other also business entities, Chinatown International District Business Improvement Area, the Alliance for Pioneer Square Business Improvement Area are involved in the Just Care initiative. So that would be more accurately described, I guess, as like a unique health and outreach campaign. But it's been a particularly effective one focused on a geographic area and offers a lot of data and tips that we've been receiving on how something like that could be replicated in other parts of the city, especially since actually the needs of the folks that are in Chinatown ID, Pioneer Square, tend to be a lot higher than in other corners of the city, which might impact the long-term cost of replicating a model like that. But anyway, that's the overview of those, how all those parts kind of interlink together, if that helps clarify it.
Yeah, thank you.
Bring up something on that. Brent, is that all right?
Sure, but let's try and be brief so we
So
can move on to the one.
I mentioned health through housing, and this is really going to be making a major impact. And we're hoping to get it off the ground in the next few months. I mentioned it's backed by a 0.1% sales tax increase as authorized by the legislature. But this is unique in that it will allow people who are chronically homeless to reside in a place not meant for, if they currently reside in a place not meant for human habitation for at least a year and with serious physical or behavioral health issues, including chemical dependency. And it's estimated that there are 4,500 people considered chronically homeless in King County. And I don't have the breakdown for Seattle there, but a vast majority would be from Seattle. This legislation will create space for up to 2,000 individuals. So what, about 45% of all chronically homeless. And we're going to purchase the hotel so that we'll be able to continue the supported services, wraparound services for these individuals. It's very exciting. And I'd say stay tuned and we'll keep you informed about it. But I think it'll make a huge impact.
Well, we're definitely...
I just was wondering if you could repeat the name of that program.
It's called Health Through Housing.
Health Through Housing. Thank you.
Yeah, and you can Google it or contact my office. We can get you more information.
And then it's county administered. Is it going to be Regional Homeless Authority administered program?
No, this is strictly a county program, and we increase the sales tax. Now, a few cities did it before us, so they're also going to have their own program, which was allowed. But once the county voted for it and enacted it, which we did, I think in October, if I'm not wrong, then no more cities could do it. But it's going to be good.
Well, it's super exciting to hear that many people. I mean, when you talk about a number like 45% of the folks being potentially served,
whatever 2,000
that's the kind of
is
visible
of
change that we're
4,500.
all really hoping to see some of. I'm going to try and call on people whose hands have been raised somewhat in the order I saw them raised. I may betray you. If so, I apologize. We're going to do our best. Next person I was going to invite was Pam McCarthy. I'm asking her to unmute and turn her camera on. We may have lost her. Pam, you around? Maybe not. All right, moving on. Oh, there she is.
Oh, yeah.
Hi.
Hi. Are you? I think my internet's having issues, but.
I hope you make it through the question.
Yeah. So do I. All of you seem like you're very familiar with the homeless policies and issues, and I respect the good work that you're doing. But I'm a normal person on the street, taxpayer, with a financial audit background, and I am a little distressed in all these meetings because
right at the cliffhanger moment. I'm going to turn your camera off, Pam, and maybe your fidelity will work better with just audio.
Okay, can you hear me?
Yeah, distressed because,
Because I'm getting, okay, because I see no data surrounding any of these programs.
okay.
Am I still with you? Hello?
Yeah, no data surrounding these programs.
Okay.
I'll give it a little more of a try here and then maybe we'll move on. No, I guess internet not succeeding in Sunset Hill all the way.
Mr.
You want to jump in there?
Just say, there are a lot of data for these programs. I mean,
Yeah, in terms of dollars that are spent.
all I can say is the county, and I'm sure the city keeps track of the
How they're
data.
being spent.
We have to do that for federal funding. We get audited for state funding. We have to provide the data. Data are there. It may be difficult for you to find it, and we could help with that if you want to contact my office. You can also go to King County Department of Community Human Services, DCHS, and click on the link that would be of interest to you to find out more information.
Yeah, I can just attest to that the Human Services Department does aggregate and produce data based not only on the federal requirements Councilmember Kohl-Welles alluded to, but for the performance metrics that Mayor Durkin put down for homelessness service provider contracts early in her term. And all those reports are available online. If you want to reach out to get the link, Councilmember Strauss can do that for you. No, I'm just kidding. I'm happy to. If you want to send me an email, I'm happy to send a link to where those reports can be found. I would just attest that, I mean, the big underlying issue is, you can have all the outreach in the world, which is what a lot of the programs we've discussed today are outreach. You can have all the outreach in the world, but people who are experiencing homelessness don't just vanish into nothingness based on outreach. People need housing, people need a place to go, people need four walls, a door that locks, and privacy. And we have well over 3,700 people who are unsheltered in Seattle right now, who we can send as many outreach workers and police out to try to deal with their situation, but unless there's a place to be navigated to, we're not going to see visible results. And that is one of the things where we are lagging considerably. And that is the big center of gravity of the problem is a dearth of places for people to go.
Well,
you might also check the Homeless Management Information Service, HMIS, which tracks the data.
Can you still hear me?
Yes.
Yes.
I did a Google and I did find that, but there was very little, it was very high level. So rather disappointing all in all.
Well,
I just added a link to the city auditor's audit of the human service contracts from.
Yeah, actually I read that and it was very instructive.
Yes, I mean, it was a good report. The auditor is an independent auditor and does really great work. I think one thing that I will say it just at a high level, and then I'll pass the mic, is that when we continue to solve for the symptoms of people suffering outside, we continue to not use our dollars to the highest and best use. And that's why I continue to say we need to have a place for everyone to come inside to in a short period of time.
Perfect.
Thank you.
We'll try and post that link to that auditor's report to Dan so people can follow up and look at that. He's had his hand up quite a while, and I know he sort of feels strongly about some of the things that you and Jeanne were just saying. As Mike Stewart, I'm going to invite him to join back on.
Terrific. Thanks so much. Appreciate the opportunity to ask a question. One very quick comment that just didn't come up in this conversation is there's a lot of a lot of talk and discussion about the notion of housing first, and we need stabilization is 4 walls and a door. There are cases, many cases that we see play out on the streets in Ballard where that doesn't work, where we see folks who are suffering chronically with mental health and addiction issues who have had housing but won't stay in it, and they're not. There's no solution yet for those folks. I wish Reuven Carlyle could have been here longer, because I'm very keen to know what funding at the state level is going to be available to help address those issues. I'm a firm believer that if we can't get our mental health and addiction issues under control, we're not going to have any success anywhere else. But I'm going to take a quick segue, not completely on homelessness, a little bit on crime, and I'll keep it fast. Small business owners are struggling to make it through the pandemic, and they are particularly impacted through the cost of break-ins, damage, and theft. And employees and residents in our community are suffering as they work to recover from violent crimes. I mean, getting punched in the chest, punched in the face, knocked down in the middle of Market Street and 15th. So in addition to their personal well-being, this is also affecting the small business community. 17% of businesses in Ballard that we recently surveyed reported that employees are leaving their jobs because they just don't feel safe. So my question is, what level of attention and resources are being considered for the victims of criminal activity?
Yeah, I mean, I can start with that, and I'm sure the other panelists have some things to weigh in on that topic as well, because I think in all of these discussions about the reckoning that we've had about the intersections of public health and public safety, it hasn't really been said enough that there really are. I mean, there are heinous criminal acts where there needs to be accountability, and I can only speak for myself on this, but when we talk about defund the police, I think most of us on the council, I can't speak for all my colleagues, distinguish between holding people accountable for violent offenses, for robbery, for armed robbery of businesses, for burglaries, that is a distinct thing from using police as mental health first responders, or using police to respond to crimes of poverty. And to that end, the city council actually added 114 additional officers in the budget that we passed in November of 2021, or November of 2020 for 2021. That typically doesn't get mentioned in a lot of the frankly hyperbolic and inaccurate coverage, I think, of this issue in terms of the budget the council actually passed. The Seattle Times is very keen on using the number of the amount of money that was technically defunded from the police budget. They fail to mention that the overwhelming majority of that money was allocating civilian services to other departments. So, that is, not satisfactory to a lot of our constituents who wanted a much bigger, more visionary restructuring of the police. But, it should also cause some comfort to the folks that are experiencing the frustration over the current situation with crime that the council actually added officers. That issue doesn't really get discussed enough when we talk about these issues. I think that the other thing that needs to be addressed is, I called the municipal court the other day because I was curious. For the city of Seattle, only adjudicates misdemeanors, not felonies. So, not most of what Mike is talking about, but some of it for sure, right? They had something like 6 jury trials in all of 2020 post-COVID. So, the other thing that doesn't really get discussed is, the King County Court is shut down. The municipal court is shut down. We couldn't prosecute people for things even if we wanted to right now. And that owes nothing to the policy of the city or the county councils. Those courts are independent, and they've decided, because we can't get people to convene and do congregate jury trials, that functionally we're in this paralyzed state where we never envisioned we'd have to have a functional justice system in a pandemic. So that has limited the amount of folks that can be held on bail to people who are committing the worst of the worst crimes. All that said, folks might see a little bit more of a reversion to some of these issues as the economy reopens and as the courts reopen a little bit. But that's the element, Mike, that frankly no one really discusses enough, is that you know, people like to beat the hell out of the city council, and that's perfectly fair. You know, we're your elected officials, and we can take it. But there's an awful lot of other structural issues that we're not the only major city dealing with that are impacting our overall way to adjudicate and take care of crime. And some of those are out of our control. And one of the ways that we've tried to cope with it are things like Just Care, which has actually had an emphasis on trying to identify people that are causing chronic quality of life issues in neighborhoods that might have historically been dealt with through the criminal legal system, but cannot be right now. And the only way to get them in a place where they're not on the street is to get them in a hotel room with wraparound services. I can't think of any other example of something that we are doing right now that has effectively been a substitute for removing those folks from the public sphere and putting them in a place where they can't do harm to themselves or the broader community and are getting the assistance they need.
Well, I'm sure we're not in the community without an appreciation for the positive impact that some of that has, but I'm sure you'll also understand that the community is going to chafe necessarily at the suggestion that we should take some comfort from adding 114 FTEs to a police department that's having trouble keeping anybody on staff in the midst of what you just declared as an inability to basically prosecute anything. It's a misdemeanor. I mean, it leaves you, I mean, I think folks understand it's a very difficult time, but it's not gonna, I don't think, garner a lot of faith in the path we're on, that we're adding some cops to the budget.
Yeah, and I actually agree with you on that, Brent, in the sense that a lot of these problems we're discussing are beyond the scope of the police to solve.
Right.
And we've also seen a police force that has had a budget increase dramatically over the last 5 years when a lot of these chronic issues have gotten worse. So there's, you know, I don't want to, you know, drag this out too much, but, you know, the STAR program in Denver, which is a low acuity first response system that responds to certain quality of lifestyle offenses as the exclusive responder now for trespass and indecent exposure, having a really big effect in getting folks that are committing a lot of those crimes, which tend to have a correlation with mental health, you know, into some kind of alternative treatment regime that is preventing that harm from continuing. So, like I would say, there are some things that we should be doing, and that's part of the Black Brilliance project that's been stood up, is to identify things like that and build them out. But I guess what I'm just trying to, the point that I'm just trying to make is, you know, I don't think it's a direct correlation between police staffing and what we're seeing. Like, even if we had more police, we can't adjudicate the things that they're investigating anyway. And by mentioning the 114 officers, I was just trying to correct the record, because there is a misconception out there that we did not try to have additive hiring, and that is not true. The council did actually approve 114 additional officers, and it was a controversial decision.
Brent, may I add something? I just want to make sure people know that while the courthouse is closed to the public, the King County Courthouse, our judges are there. The judicial branch employees are there, and the district court and superior courts are operating. Those with juries cases are having juries participate remotely, virtually. But the access to justice has been severely limited and harmed, especially when we're dealing with remote access, so that individuals who are not English proficient, who are immigrants, have a much harder time. People who do not have the digital means and abilities. So that's part of what we are emphasizing in our next COVID budget. Really critically important.
Thank you.
And then Brent, just real quickly, and then I see Laura's got a question as well. Just to highlight that I put forward an amendment in our budget process last year to close a budget reduction for the mobile crisis team, so that, and we actually added a little bit of funding. Mike, your original question, completely spot on, that the state level is the correct level of government that should be funding behavioral health services at this level. And, you know, what I continue to say is, if the state's not going to do it, and the county is providing the majority of the mobile crisis and crisis solution centers funding. So, you know, and when when it's still not enough, I'm not going to pass the buck because we need to step in. And so Councilmember Lewis supported me on that amendment. And I just wanted to flag that.
Thank you both.
Thank you. I know that we had one hand raised a long time ago for one more. Do you have a follow-up quick, Laura?
Yeah, I just wanted to say, this was actually what I was thinking about saying earlier. And since Mike opened this door, I think I will say some of my original thoughts. In response to Councilmember Lewis, I thought it was really interesting when you said that, council feels beat up on these issues. And so I just wanted to note too, that those of us in the small business community also often feel that whenever we're expressing our frustrations with these kinds of situations that we're facing every day as small businesses, I think sometimes we tend to be lumped in with big business interests, or assumptions are made that we're somehow not compassionate to the problems that our unhoused neighbors are facing, that we're only looking out for our own interests, when the reality is that we are very community oriented. We are always trying to activate and help within our communities. We're thinking very much about our employees and the safety issues that they are facing when they're on the job for us. And so I just wanted to assure you that from my corner of Seattle small business, in particular in the Ballard Brewery District, we're very interested in being an active part of compassionate solutions and programs. We aren't, we aren't trying to stand in the way of programs like defund the police. We're trying to understand and know how we can help, and so all of our communities can work towards better situations for all of the citizens in our neighborhood.
Anybody want to comment on that? I think it's an extremely thoughtful point, Laura.
No, and Laura, I think that was great, and I think the point that I was, that I was just trying to make was that we, and like we all need to take a little bit of a step back, I think, to look at the big picture of the system and what isn't working right. And it's important to center that, you as a small business owner and all the other small business owners that might be watching this don't deserve to be in a position where your windows are routinely broken. You have to, sub in yourself as an outreach worker on occasion, or a behavioral mental health professional, or fight to exclude people from your business that are causing problems in there. And we need to, have a broad scope, and like looking at the various tools we have to provide, support for everybody in our community, including small business owners that are experiencing those issues. I think that we've had a media narrative, I think, throughout last year that has been a little overly prescriptive or simplistic in how they analyze the issues that we're facing. And there's also been a lot of fast and loose playing with things for political reasons. And when I come to places like this, I think we need to center the work, we need to center the issues, and work back from those common values of, everyone in the community deserves help. We shouldn't minimize the impact on small business owners from the situation that's currently happening. And I think sometimes those things get conflated. And I agree, I think sometimes small business owners are unfairly maligned just because they have the very simple request that, we don't want to be in a position where there's vandalism or whatever else, but we want to proactively work towards what the solution is in a humane way, right? So I'm totally hearing what you're saying, and I'm glad you said that.
Thank you. I appreciate that you're hearing that.
Yeah. I mean, I think since I said we were going to try and be done around now, I'm going to try and make an effort to wrap this up. What I guess I'm mostly left with here is sort of a strong sense that we've kind of barely gotten our feet wet on things a little bit. A few things kind of occur to me. One, that we should, and I think can continue this kind of a conversation between the community and folks working on these issues at the government a little more. I think maybe we should talk about trying to put together some sort of a workshop, some kind of a Saturday thing that gives us a little more time to deal with this. I want to really acknowledge the challenge that it is to be a lawmaker at the city, county, or state level and be trying to answer a lot of questions about implementation of programming, which really kind of happens more in a lot of ways on the executive side. I mean, you decide to pass a budget that gives the police department 114 hires, but you don't manage those cops day in, day out when they're coming to Ballard. And I understand that. I think we understand, but I want to remind people that, you know, as was kind of alluded to here, that the council members are essentially the face of a lot of the government, not necessarily responsible for all the implementation per se. They're just in an interesting role of being ombudsmen and liaisons for us to our government. So I would like to try and do something further that maybe includes a little more of the executive side, management and program staff to really kind of do something more plenary if people are interested. And I think they would. I mean, I've said before several times, you know, we have kind of what seems like the most best chance of trying to deal with some of these issues in a place like Ballard, where you have a discrete geographic area, a really interested populace, a really progressive constituency who really care and are compassionate for the issues that are facing people. Most people here do not feel like we should just be locking people up or sweeping people out of the way in any way. Most people feel exactly like Laura, a local small business owner, just illustrated, that she wants to help solve the problem so that she can keep selling beer and so that people can feel safe working and enjoying the place where we all live. So I think we'll keep trying to do what we can in the district council to promote and support that kind of conversation. And again, I hope that in a place as progressive as potentially successful as Seattle, we can really make a lot of progress in the next year or two, because if you can't do it here, it's really hard to imagine that we're going to get any kind of, you know, broader solution going in any of these more, I'm going to call them moderate or right-leaning suburban cities that surround us. So hopefully we'll be able to do this kind of meeting again in the near future and continue to try and delve in. I apologize to those who feel like we've kind of gone all over the place on issues and haven't really solved or gotten too far. As you can see, it's not necessarily an intransigent issue, but it's one that we're going to have to keep working as a community for a long time to really get on top of. And it's just going to get tougher.
May I make two announcements before?
Why don't you make two announcements?
One is that
I'll make one.
I am holding a town hall on March 3rd in the evening. It'll be on Facebook and Zoom, but it's with 3 other council members, Joe McDermott, Gurmai Zahalai, and Rod Dombowski. And the focus will be primarily on public health, but we'll be having questions, period. Secondly, Dal Constantine, County Executive, is on KUOW every Tuesday from 12 to 12:30. He's asked questions and also from the community, so you can weigh in there. And I think Mayor Durkin does the same, maybe on Thursdays.
I think she's on Thursdays, yeah.
Thank you for
And then Brent, if Councilor Kohl-Welles, are you?
through.
Go ahead, Dan.
Great. I'll keep mine short. You know, as the chair of the Land Use and Neighborhoods Committee, my deep focus area is in land use and neighborhoods because homelessness is such an issue in our neighborhood. I am a very active member of the Select Homelessness Strategies and Investments Committee that our good friend here, Councilmember Lewis, chairs. And so I just want to thank him for all of his good work there. I just put in the chat the information regarding the cold weather shelters. And then in my most recent newsletter, during my recent District 6 resident hour, they asked me what are 6 things that they can do today, them as a private resident, to address homelessness. And so we put together a list of 6 actions that have a multitude of different options. And if you are not on my newsletter, please sign up. And all previous newsletters are archived on my website. So thank you for having me, Brent.
Thank you very much for being here. Thanks for that. We'll try and forward links and information as much as we can in our very limited volunteer organizational capacity, which is sort of a segue to also say that, you know, one of the chief, I guess, complaints or concerns about the district council process historically has been its lack of diversity. And as I look around the screen tonight, I definitely want to just acknowledge that we're plenty well aware that there's not a lot of age or ethnic diversity showing up on screen here with you at all. That's something we would really direly like to change, and we would really like to see more people more involved in the Ballard District Council. We've worked hard over the last few years to continue the work and the effort of the district council here in this neighborhood, despite the disconnection of the neighborhood district council process from the City of Seattle Department of Neighborhoods that happened under the Murray administration several years ago. We continue on as a nonprofit. We think bringing a pretty critical role of trying to enable the community members and community organizations like those you've seen tonight to be able to get together and continue to network in this kind of public and neighborhood format. We hope to do that again live and in person, either at the Ballard Library or at the Nordic Museum or at the Sunset Hill Community Center where we most recently met. But until we do, we'll keep trying to do it online. But I guess all of which is just to say that we would really love to hear from some folks. If you care enough about these issues to be on here asking questions or to be on any number of social media forums complaining about the work of the city or the county officials who are working on these, or arguing for more and better services for the folks suffering homelessness or any other of these things, get involved. We would love to hear from you. Our emails are all right there at ballarddistrict.org. So would love to have people just get engaged more with us, because volunteer resources will make more power, will make more people be involved and more aware. So that's my end pitch. I want to really thank all of you who joined us from the community, invited or and participating and or the panelists, Councilmember Kohl-Welles, Strauss, Mr. Lewis, thank you very much. Really look forward to having you with us again.
Yeah, thank you for organizing this. It was good to be here.
Appreciate your time. We'll be back. All right, so with that, I'm just going to say goodnight. I don't know if Snowmageddon is on or off as the most recent forecast came through. I think it's mostly going to snow down in Olympia, so maybe Reuven's trying to get out of there before the snow cart starts dumping. But stay safe, everybody. Wear 2 masks, I guess, is good advice now. And hopefully we'll see you live and in person in Ballard soon. Thank you and good night.
Thank you. Good night.